So I'm a little different from the previous speakers. I told you about what sucks. I'm going to tell you about something that went right. And I want my health department staff sitting in this middle table, and Craig Humbar. Are you in here, Craig? He's with the state. We have, stand up, will you? And the one with the blue, right here in the front, the one with the blue sweater is the nurse who took care of all this. What makes me different is, in some respects, is I'm a medical doctor. I've been a hospital CEO. I've been a state health officer. I've been a member of a board of medical licensure. I am a county health official. I am a cancer patient. I was one in 1966 with a melanoma, and I'm one today with a lymphoma that is not behaving itself very well. I have been a political appointee. I have lost a child to cancer. I've been in the ICU twice with arrhythmias. I found out Jack Daniels was doing it, stopped that crap, and haven't had any trouble since. I have been sued. I have been called before congressional staff for questions, and I have signed quarantine orders. So I don't know whether I'm an advocate or a target, but here I am. I want to talk to you about this stuff. And I'm going to talk sort of in the terms of if we're a clinical case. The background, the chief complaint, initial data, initial treatment plan and orders, and subsequent data and subsequent discharge. Let's see. We've had a lot of fire drills here in Lexington. When the H1N1 came through, everybody went nuts. I mean, they were lining up demanding vaccines. And we called a lot of people together. We, the health department, did, and figured out how to try to calm the anxiety, get the shots done. The problem was they were overwhelming the medical care system, and we didn't have a really good plan to deal with it. But fortunately, the Lord intervened, and the thing died off within about the time it was going to be really rough. We have a long history of the Lexington Health Department helping local practices. We have a strong relationship with the Kentucky Department for Public Health, partly because I used to be its commissioner until I came here. I was chief of staff to the Surgeon General, then state health officer, now county health officer. And I tell you, the crap I learned on the way up and on the way down makes me something to contend with, and a pretty good teacher from time to time. The hospital groups, the CDC, University Hospital, and we work a lot with the direct care community, which goes way beyond doctors, nurses, and hospitals. And critical to all of this is we have a very, very healthy relationship with the electronic and print media in this area. They trust us. They trust us. So keep that in mind as we go forward on this. So what was the chief complaint? Well, a physician here in town who had worked with us before gets this lady coming back from Liberia. She's a school teacher. It's Friday afternoon. It's always Friday afternoon in the public health world. She presents to her doc with, I've been to Liberia, I got this fever, I got the bad all over us, and I got this skin condition. Somebody treated me with an antibiotic Bactrim the other day, but I'm not getting any better. So what's the doctor do? Instead of going, oh my God, I got Ebola. No, she calls Katie Myatt. Says, what do I do? Katie activated the entire system. So this was about early in the afternoon, right, when she called you? By 6 o'clock, we had a conference call, starting with the CDC experts, all the way to Katie, the doctor, the manager, the guy that ran the big clinic. Everybody you can think of was on the phone figuring out what do we do. That was a very critical step. And the reason this thing mattered so much is she had spent Thursday, Wednesday, and Tuesday in meetings with school people getting ready for school, which is going to start next Wednesday. So we had a bit of a social code blue along with a possible clinic problem. And we had to figure out, what do we do? Let's see. She had some non-specific signs and symptoms. So what did we do? We confirmed all the initial data. There was one suggestion of, well, maybe we ought to do Ebola testing on everybody. Now, I'm 75 years old. I've been in this stuff since 1964 in Guatemala. And I said, you start testing everybody on this one, you're going to be testing everybody on anything that coughs, spits, itches, and has a fever until this is 2 or 3 months before all this happened. And I forgot to mention, this was all in August, into July, early August. Well, over Memorial Day weekend, we had a family come back from Saudi Arabia with fever, bad all overs. And is it MERS or is it not? We didn't know, so we ran the drill, actually put them in the university hospital, didn't have to officially quarantine them. They agreed to stay, did everything that had to be done to prove it was not MERS. So we had practiced the same drill 60 days earlier. So we got this lady in, we collected the initial data, contacted all the major players. I mentioned the conference call, put her UK in isolation, and our emergency medical services group is tied in very closely to the health department in the hospitals. We have in Lexington something called the Emergency Medical Advisory Board, which is chaired by the Public Health Commissioner, who doesn't know boo about emergency medical services, but is sort of a neutral leader who can referee nurses, doctors, hospitals, EDs, businesses, and everybody else. And we just were accustomed to working with each other. We got the confirmatory lab tests, and we did not test anybody else. Well, this was Friday and Saturday. I think there was a conference call Sunday. The one general practitioner in the crowd, said, guys, anybody think this might be Bactrim reaction, sulfa? Maybe it couldn't be. She's been in Liberia. Monday afternoon, Bactrim was the problem. But anyway, we ran the drill. There was no laboratory data suggestive of an Ebola infection. The clinical picture was consistent with sulfa allergy, and the drill enabled Lexington to respond effectively to the fear resulting from the Ebola situation later that year. Later that year, when Dallas erupted, the media in Lexington jumped on all the big hospitals. What are you all doing about Ebola? Well, they let it run for a little while, a day or two or three, and then the number 2 guy at the University of Kentucky medical system calls me up and says, Rice, you got to get these guys off my back. They're killing me. So what do? Trot out the public health official. He's dispensable. You call a meeting with all the players, and you lay it all out, and you come up with 4 or 5 things. And it's not the purpose of this meeting to go into that. But the purpose of this meeting for everybody in this room is when you got people scared and you have no game plan really worked out, you better get them all together. And when you call it and you have the right kind of person running it who will let everybody have their say, and you write it all on flip chart paper, and at the end of the meeting, you pull together the 4 or 5 things that really matter, and everybody knows they got heard, and everybody agrees these 5 are important. You left out my 3, you left out my 2, but you take the field that way with a plan to follow up, and you have the media in there at the end of it to brief them on what happened. You got something you can work with. That's all I wanted to tell you at this part of it, and I got this done in less than 8 minutes.